Email from Health and Human Services that the cutoff for eligibility notices will be 3 p.m. on 2/15. Now, what that means is that if your client or you log into the marketplace through the direct link or on your own, and you try and do a subsidy determination after 3 p.m. on 2/15, then you will not be able to get a 3/1 effective date. So between 3 p.m. and midnight, you're going to have a problem. So you really want to push the fact that that's going to be that cutoff. Now, they will be able to obtain and to enroll after that, of course. And even on the 15th, if you did a subsidy determination at, say, 4 p.m., you're just not going to get the subsidy determination. The systems and the communication is going to be down. What you would have to do if they required a 3/1 effective date is to call the marketplace and do the change and do a request right on the marketplace for that 3/1 effective date. So it's important that you're voicing this to your clients. As we know, the phone number is right here, 800-318-2596. That is for the marketplace. They will have to call the marketplace to make that effective date change, and you also need to be conscious of this. So please make sure that you're instructing your clients. This is not a time to wait. We don't want to dilly-dally around. We want to make sure that we're doing those enrollments. Because as of 2/16, then we're working on a 4/1 effective date. Then remember, as we move through AEP, you will then also be offering a 5/1 effective date. Annual election period runs through 3/31. That means that you are able to take an enrollment up to March 31st. And after the 16th of March, then we'll be working on a 5/1 effective date. And based on IRS and healthcare reform rules, there would be a subject to a 1-month penalty at that point for the month of April. So you have to be conscious of these rules. You have to make sure that you understand this. These changes, we've talked about extensions. We've talked about them, making this go further, and that is not happening. Many of you have heard as well that the the large group has been pushed off for another year as well. So any groups that are 50 and higher, they're looking like they may even make that 100. There's still some clear guidance coming out on that. That has been pushed off for another year as well. So as we move past this March 31st date, a lot of the tones of our conversation are going to talk about how we're going to be able to manage and how to obtain other business. How are we going to do with other marketing efforts and marketing campaigns so we can get in front of more people? What are those conversations going to sound like as well? So lots of good stuff that's going to happen. We've got all of that on the drawing board. We're working through it now, making sure that everyone has other opportunities with Florida Blue and with the government and with the marketplace and all of these plans. So we're very excited about that. We're not excited to see it end. We're hoping for an extension, but we have to roll with the punches, so to speak. Next thing I want to cover is some issues that people are actually having with healthcare.gov, and the issues that people are having when it comes to getting a subsidy determination. Remember that if you're not able to get to the marketplace through the direct link, you can always log in, create an account. You're going to be wanting to use that with a Join Me session. But what we're finding is that a lot of folks are having issues working through with names that are hyphenated or names that have special characters. So, for example, the name O'Hara, O''Hara. You would think that that would be simple, that would go right through. Unfortunately, any special characters such as a dash, such as an apostrophe, if you have that little funky thing over an N on your name for some of our Spanish clients, what do they call that again? I don't know what they call that. Enye, that's it. If they have that in their name, those special characters will not and will cause you to have an issue getting subsidy determination. So you need to make sure that you're removing any special characters. Okay? That has been causing a lot of people a lot of grief. The next thing I want to bring up to everybody's attention when it comes to errors that we're having is more related to post errors. So if you've gone through and you've created a subsidy determination, you come back into Blue Cross and you do the application, and let's say that you mess up the spelling of a name, or you mess up a date of birth, or a phone number, or an address, or any basic demographic information. Well, we were always getting the runaround, and as many of you experienced, you would have called Florida Blue to make that change, and they would tell you to call the marketplace. You'd call the marketplace to make that change, and they tell you have to call Florida Blue. Well, the way that you make any demographic changes is with the marketplace. Now, you may have to get a supervisor on the phone when you call the marketplace, but if you are going to make any changes to demographics, it has to be done by the marketplace. Under the rules that have been delivered, the Blue Cross is not able to make any demographic changes on the behalf of a client. So if they send us a driver's license, we can't change it. We can't do the simple things that you would imagine that we would be able to do. And because of this government involvement, it must be done through the marketplace. Now, I can clearly tell you that it has been working. It's been working very well. You just call with the client on the phone. You will give them their subsidy eligibility or other identifying factors such as date of birth or address or things like that. Good morning, Margaret. And then at that point, you would tell them what the change is going to be and what you're going to need to make happen. They will transfer you to another department. You will wait a little bit longer, and then you can make that change. So know that all of those demographic changes can be made and should be made. Now, the next thing that I want to cover is going to be people who are on Medicaid or people who have been sent to a governmental program and they are telling you that they were declined for said governmental program. So, for example, Medicaid is the example that I like to use. So, if, for example, I was married, go figure, and I was going to want to have my family. My wife was, let's say, going to being sent to Medicaid. We went to Medicaid, and then that Medicaid application was declined. Well, I would have to utilize my declination letter and then contact the marketplace to enroll in a plan. Now, if we're talking about an add-on or if we're talking about adding that person to a plan, all of those effective changes have to be done through healthcare.gov. There is no mechanism within Blue Cross for you to do that enrollment. So what you would do is a couple different options. You can call the marketplace with your client on the phone. Explain to them the situation, and then they will have you send the cancellation letter or the documentation from Medicaid that they were not enrolled. From that enrollment, then you would simply tell them what you wanted to do. You want to enroll them on a plan, and then you would maybe have to do a new subsidy determination. You are going to have to get that guidance from the marketplace at that point. They will be able to do the enrollment as well. So lots of different things that you can do there, but making sure that you're paying attention to that is very important. Green cards also are going through rather simply now. Not too many problems going on with green cards, so those should be going through. No one seems to have any questions about the green cards at this point. They are moving through rather smoothly. If you do have two adult families that are on a healthcare.gov application, for example, a mom, a grandma, grandpa, two taxable households within one household, what it will do is those can only be accommodated for enrollment through healthcare.gov. What they will do is they will do a subsidy determination, and then the policies would be split. So, for example, grandma and grandpa would get their own policy, and the rest of the family would get their others. However, that is not eligible through Blue Cross. It has to be done all on the marketplace in that capacity. So those are some of the big ones that we've been dealing with. Some headaches that have been coming up when you're trying to do subsidy determinations. If anybody's having any other difficult times, post your question into the question box and I'll address them. So let's kind of go through some of the questions that have come through as well, and see what we've got going on here. I have a client on unemployment. If and when his income changes with employment, an SEP? Can he then change plans or just his subsidy changes if still under income eligibility? That's not going to be a plan change. Typically, that's not a life-changing event. That's a change in income status, Lorraine. It sounds as if that's all we're really discussing is a change in income status. If there was a significant change in income status, then you can request an SEP. And that's going to kind of bring me into my next point with requesting of SEPs. As you know, we did give everyone a little bit of guidance when it came to what SEPs were going to be used and available. Everybody should know that those SEPs still not have been disclosed. However, there has been guidance that you can call the marketplace and you can request an SEP. Now, that SEP that you would be requesting would have to be for negligence on the behalf of someone. It would have to be from ignorance of selecting the wrong program, but the government has to dish out the SEP. You can't just assume that you've got an SEP and take an enrollment, because by taking that new enrollment, it will not automatically terminate the other coverage. And if for some reason you would log into their account either through the direct link or utilizing their username and password, by terminating that coverage without an SEP being offered and already approved, you could be causing that person a hardship and not even allowing them to enroll in a new plan. So you got to be really careful with that. Okay, so I thought the government revised the individual mandate penalty so that anyone who signs up on or before 3/31 was not to be subject to a penalty. They're only subject to a prorated penalty. It is not a full penalty. It would be a prorated penalty for 1 month. Now, there is several different interpretations of that rule, Will. I've brought that to Blue Cross's legal department, and they've given me different interpretation as well. What I would anticipate is that you inform all of your clients that they could be subject to a prorated penalty, because that way you've protected yourself. So if they get a prorated penalty of 1/12 of a penalty, not going to be the end of the world, but it is something that could help build urgency in the sales process. That is something that they will be dealing with the IRS on. It is not something that we want to spend too much time on it. We want to use it more as a way to build urgency for your clients. Next question from Will is, if someone needs to make a plan change and they are able to do so, example, it's before the effective date, does that need to be made on the marketplace or with Florida Blue? Both. What you would have to do, Will, is you would have to log into the marketplace through the direct link. You would have to look up that other application and cancel it and terminate it. You would then reapply by bringing that client back into the issuer website and picking a new plan. The termination has to be done on the marketplace, or Florida Blue will never see the new plan, and they will be stuck in limbo, as many of our clients were stuck in limbo back in January. So make sure if someone wants to make a plan change and they do meet the requirements, you log into their account via the direct link or their username and password that they've created. Terminate the other coverage. Then you will bring back to the issuer website the new coverage or just simply enroll. But please confirm that your national producer number is listed on there, and in order to make sure that that's done most appropriately, use the direct link. As many of you know, the direct link does not require your national producer number any longer, so you will not be entering it. And many of you probably experienced that. And if you haven't experienced that, it means you need to write some more applications. But what you're going to see is you're not going to have to put that in there. The only time you're going to have to put your national producer number is if you are imitating or you're working with the client going direct through the marketplace without the direct link through Blue Cross. Going to have to come up with a new word for direct. Okay. We have a client who qualified for a subsidy confirmed by the 14-page letter from HHS. On page 2 of the letter, it says that the client needs to send the marketplace proof of income, and the documentation must be sent no later than May 1st, but not by May 2015. Is this a typo or actually a drop-dead date? No, David, that's actually a drop-dead date. What that means is that you've done a marketplace application with subsidy determination. They were not able to verify the income that you listed and what should be his income or her income for 2014. Because remember, you're answering the question, what's going on in 2014? If I am showing that I used to make $60,000 a year and now in 2014 I'm going to make 30, they're going to ask me to prove why I'm going to make 30. And there are a couple of different options that are given to you when you're offered that. If you're a self-employed individual, a pay ledger, something from your QuickBooks, something from your bank account. If you're a W-2 employee, then you would need to provide a pay stub or some sort of documentation that would prove that document, that pay. So, not a typo at all. It is something that you have to make sure that you get to because they could be subject to losing their subsidy at that point. And if they lose their subsidy that because they didn't provide correct documentation, that is not an automatic SEP. Now, if it was on the negligence of you, David, because you didn't tell the client that they needed to send that in, then that client is going to end up calling healthcare.gov and they will probably offer them an SCP. So that's why it's very important that everybody on this call, as well as all your agents that are in your agencies, are sending that subsidy determination letter to your clients and making sure that they understand it and read it. Very important that that is done. Otherwise, situations like David is having where someone could lose their subsidy would come up and would occur. Some great questions this morning. Does anyone else have any other questions regarding the marketplace as we move on? Okay, perfect. So let's talk a little bit about issues that you may be having. You should be working with your agency owner or director to address and maintain any issues that you're having with 2/1 effective dates. We as an organization have identified very large numbers of applications with people even with 2/1 effective dates that were not able to pay or didn't pay, and those need to be brought to your agency director if a 2/1 effective date is required. Because we are past the acceptance of a 2/1 effective date payment, and you are now working on 3/1, and you have a whopping 2 days to get all of your 3/1 applications in. And then we'll be working on 4/1. So you need to make sure that if you have elevated cases that you've been working with agency services on, or people have not been able to get their identification cards, or if you're not comfortable that they're enrolled, you need to get on the phone with agency services. You need to get those applications and reference numbers and check and find out what is going on. There are special circumstances where people can and Blue Cross will honor that 2/1 effective date, but you will need documentation as to why. So you will need to get with your agency director to make sure that they can help you with that process. Those of you, the agency directors here, you should know at this point they're going to need to call Florida Blue, find out what the situation is, make sure they get a reference number for that call, and then from that reference number on that call, make sure that you funnel that back through the appropriate channels for research if we need to get a 2/1 effective date. Okay. Any questions that anybody's having right now? Any other questions? Let's talk a little bit about CMS issues. We got a lot of agents on this call today that wrote a lot of Medicare business. Again, bravo, you did a great job. A lot of you, this was your first year of selling Florida Blue. What happens after AEP is, as you may or may not know, Medicare clients feel as if they maybe got sold a bad bill of goods. And the reason why I'm bringing this up today is because I think that everyone on this call needs to be prepared and understand the CMS monitoring process that we have with Florida Blue. Now, with that monitoring process, when you have a client that is making a complaint against you, against your presentation, or a CMS violation based upon the information that was discussed, Blue Cross will send you a note. And this note must be addressed and must be answered in a timely manner. I'm not sure. Gigi, do you funnel those through the MAs, or do they get them directly from Carmen and those girls? Okay. So what will happen is Gigi will forward them out to you. They do need to have a very professional response to them, and you will need documentation and many times to back up the conversation. And these conversations kind of go very simple. Some are really easy, some are very complicated, and I just want you all to be aware of how this happens. No one is angry. It's not that you did anything wrong in some cases. Some cases you absolutely did do something wrong. But in many cases, it's just a level of understanding of the benefits, or it's a level of understanding of how the process works. For example, let me tell you one that we got yesterday. Excuse me. So that way it'll be pretty clear. We had a client who called Blue Cross, made a complaint against the agent because they went to go fill their durable medical equipment at Walgreens. And when they are trying to get their diabetic testing supplies, that all of you should know is durable medical equipment, and those diabetic testing supplies at Walgreens or at a retail location have a cost associated with them. So therefore, when the client went to go fill their diabetic supplies, they had a cost associated. They had to pay something, and the agent told them that their diabetic testing supplies were free. Now, the agent had, gone through this with them, told them they needed to get it through CareCentrix, through our DME supplier. However, the insured did not remember that conversation. So therefore, we needed to formulate a response referring back to the conversation. The agent had notes on the conversation, an agent worksheet that we utilize within A&B. And something that you guys should establish some business rules internally to where your agents as well as the agency has some backup or proof to the conversations that you had with your insured. So now we have got that response. We'll send that back to Blue Cross and everything will be hunky-dory. Now, some of them are a little more complicated. Some of them were doctors or medications and other areas, and you need to address them in a timely manner. And let me tell you why it's so important that you reply back to them in a timely manner, and why it's so important that if your client calls your office, you don't blow them off. It is all about star ratings, okay? If a client calls your office and you decide that you're not going to deal with it, they've been calling, and then that ends up getting to Blue Cross, and then that ends up becoming a CMS complaint, then that's going to effectively lower our star rating. Okay, big deal, right? We get one phone call and that's going to lower our star rating. Well, you have to understand that if you've got 20,000 members and you get 10 complaints, that could potentially lower your star rating down a half a star. And we can't afford to have our star ratings lowered, because by lowering our star ratings lowers the reimbursement package from the government, which therefore decreases our benefits or the ability for us to create a higher level of benefit package for our insureds. So customer service and a job well done during the sales process, identifying the needs, as well as enrolling in the correct plan and being attentive to our seniors from Medicare is so important, because the better a star rating we get, the better our benefits are going to be, which directly equates to more sales that you're going to be able to write, more referrals that you're going to be able to get from the job well done. So please make sure that you're addressing those concerns. Additionally, that is going to go hand in hand with the things that we were talking about earlier with SEPs for ACA. Now, I know I'm talking about over 65 and under 65 at the same time, but as we make this transition over the next few years, the governing body of, what's going to be dealing with healthcare.gov is CMS. And when it comes to rules and restrictions, and when it comes to offering these SEPs that we're talking about, that is all going to be stemmed from HHS and CMS, and that's why we have to do a really good job. We have to do a good job of identifying medications on the formulary for our under 65 folks. We have to do a good job for our over 65 folks as well. So be prepared for those CMS complaints if you get them. The more business that you wrote, the more complaints that you're going to get. It's just the way that it goes. You try and make everyone happy, but the goal is for you to be as attentive to the needs of your clients if they call, so that way you can avoid a call to Blue Cross or avoid a call to, even worse, CMS. Because if CMS offers them an SEP to change their plan because of your negligence or because of your inability to, check doctors or medications in an appropriate manner, they will give that client an SEP. That client can get an SEP to move to a different plan. Then you lose your client, you lose your commissions, you lose all the way around. Everybody loses. The client loses from a poor experience. You're not getting any referrals from that client. All the way around, it's a lose, lose, lose for everybody. So please make sure that you're handling that appropriately. I know that all of our agency owners will do a great job with that, all of our MAAs. Okay. So that's going to bring me to the medication guide. I know that we've been having a lot of questions with the medication guide. You should all have a copy of this medication guide, and this is for under 65. The link is in the chat message. You need to be using this. You need to be utilizing this daily. I don't ever close this from my screen. There are a lot of areas in here that are covered with medications, and you need to be addressing these. A lot of you that are on this call weren't writing a lot of underwritten plans before, but in the past, as I probably told you before on other calls, if you took any medications, we weren't insuring you, or you were going to get such a high rate up that you probably couldn't afford your medications. That was a joke. But now, with the Affordable Care Act, you can get people that are taking high levels of medications and all different kinds of things, and we're still going to insure them. And it's important for you to be sending them a copy of this formulary list and identifying this formulary list with them. And there's a couple of things that you need to make sure that you're understanding, and the one thing you need to understand is this little column here that says responsible steps. We're getting a lot of calls and complaints because this has not been addressed with clients, and this is internally. So what you guys have to understand is that if you see this responsible steps checked off here, that means it in very similar to a approval process that you have with Medicare, the doctor has to fill out a form and send it into Blue Cross so that way we can fill that medication. It's almost like a prior authorization, but it's from the doctor. And what they want to make sure in that is it's going to be treated like a stepped rate therapy. Before you can fill this medication or before you can fill this medication, there may be less expensive medications that they need you to try and fill first. Now, if your doctor has already gone through that, you don't need to do it again, but they are going to have to write a note. They are going to have to fill out a form. It's not just a handwritten note. So you can see here in on page 1 in the index, it says Responsible Steps Program. You can come right here and you can get the authorization form. Click on the authorization form, find what it's for. If, for example, here, fill this out, and then they would have to send that into the fax number that is listed right on the sheet. I've gotten calls and people are saying, well, where do we send it to? It's right on the bottom of the sheet. And this form is different based on the type of drug that they're filling out. That's why it's very important that you send your clients this medication guide and you discuss this ahead of time. Because if you don't, then as these SEPs become more accessible for folks, they're going to be calling on an SEP for you and saying, hey, my agent didn't tell me that I had to do this. This is incorrect. My doctor's not in the network. My medications aren't covered, blah, 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 whatever it may be. And if that's the case, they give that person an SEP, they enroll in a different plan, and then you potentially lose the commissions and the credit, as well as not having a happy client. Okay, let's answer some question. Can you please confirm that Blue Card different between Blue Options and Blue Select plans? Select Blue Card only outside of Florida. Options Blue Card all of Florida and U.S. Okay, Lorraine. So the Blue Card has nothing to do with the state of Florida. The Blue Card is when you leave Florida, and the Blue Card comes with our Blue Select and our Blue Options, and it's the same. So what happens is that with a Blue Select or a Blue Options plan, you get the Blue Card, meaning that I can visit any participating Blue Cross provider in any other state and be treated as in-network. However, when I'm in the state of Florida, if I have the Blue Card, it does nothing for me. So the Blue Card is not going to help them when they're in the state of Florida. They have in and out of network benefits on both of those plans, and if they're in the state of Florida and they're traveling outside of network, they will be accessing out of network benefits. So again, let me repeat that. The blue card has nothing to do with the state of Florida, only outside of Florida. And I know that that's kind of funny. So let me just kind of address that as well, because I'm sure other people have that same question. If I have a Blue Select plan, I'm living in Tampa, and I want to go to a specialty facility in Miami, and they don't take the blue card. They don't take Blue Select. I can't go to that particular facility and get in-network treatment. However, I can go to Georgia and find a doctor that takes Blue Cross in Georgia and accepts the blue card by using our provider directory and get treated as in-network out of state. It makes absolutely no sense. I understand it. But the blue card is what is going to give them in-network benefits out of the state of Florida. Blue Care is an HMO, and the only coverage outside of Florida is emergency care and urgently needed care offered at an emergency room. You should also be aware that on the Blue Care, remember, if it's an emergency service that ends up in hospitalization, the hospitalization as well will be treated as in-network if there's no choice. So with a Blue Care program, you're not going to get a knee surgery outside of the state of Florida. But if you have Blue Select, it may benefit you to get that knee surgery outside the state of Florida at a specialty facility, simply because you may be able to use a better facility. The Blue Select network, as everyone knows, is limited in the state of Florida for hospital, specialists, and other services. Lorraine, does that answer your question? Okay, perfect. So let's just see. Any other questions here? How does an MAA get included on the agent locator service on the Florida Blue website? David, you're going to have to speak with Gigi about that. I'm not quite sure. I don't think that's not an option. I don't believe. So I wouldn't expect that that's going to be happening. Gigi, you're saying that that's not an option, right? Yeah, I'm sorry, David, but by the way that they've structured the database, they will not include the MAA agencies and agents in the agents locator. So, apologize for that. Okay, does anybody have any questions or anything else that you'd like me to address today? Very short call today, and we can let everybody get going. Is there a number that we can report incorrect provider information on? Karen, I'm not quite sure. Do you mean that there's a provider that's listed that doesn't take the plan, or can you explain that a little bit? Let me just let me unmute your phone. Karen, what's your question? How do you? Karen, I've unmuted you. Okay, maybe not. So, Karen, if you could retype that in, I'm not quite sure. If you have a provider relation issue, Gig, who do you want them to funnel provider relation issues to? Okay. What you would do is just make sure that you obtain the information, do a screenshot of the provider online, and then communicate that issue to Gigi DeFalco, which is gigi@abifg.com. You guys should all have her email address. Send that over to Gig with your concerns, and she can funnel that up to provider relations, and we can get it addressed. A lot of agents are experiencing doctors' offices saying that they don't take Obamacare. Just want to make sure everybody understands we don't sell Obamacare. We sell Florida Blue. So unless the doctor has stopped taking Florida Blue from that particular network, they take Obamacare, whether they like it or not. So a lot of doctors are telling people, oh, we don't take that Obamacare stuff. If they're on the provider directory and they're listed in there and they're not taking the benefits, or they're giving your customer a hard time, get a screenshot that they're listed. Make sure that you have identified that they are in network for that particular plan. For example, Blue Select or Blue Care. And then if, explain that difficulty to Gigi, and she'll send it up to the appropriate people. There's going to be lots of good changes for Medicare next year. We're talking about some really good stuff. Just so everybody on the call knows, they are talking about expansion of HMO, expansion of local PPO, some new mechanisms for enrollment to make things easier with less mistakes and less errors. Bravo, very happy about that. So lots of good stuff that we'll be communicating to everybody as we get all the details. Gigi, as well as myself, spent the day up at Blue Cross, really going through a lot of the hurdles that we all experienced, and your voices were heard. Gig and I went up there with a stack of things that we needed to address. And we thank you for the good communication, and it's something that we'll work to fix it with them. So we don't know if there's an issue unless you tell us. Please provide the address for clients to mail in payments. Ellen, we'll have to email that out because I don't have it handy. The address that payments are going to, if they're mailing it, would be located on their bill. So it's right on there. I just don't have it handy, but we can get it and send it out to everybody. I would advise anyone who's trying to make a payment not to mail it, quite honestly. I would access the payment option through the online portion or through the phone number, as well as setting up APOs. Your APOs or the automatic payment options should be set up through the phone number or the My Blue service portal on the main website. So as a member, once they're enrolled, click on members, do their registration with their identification card, and then they can set up additional payments in here as well. Okay, so nobody's having any other problems when it comes to payments, healthcare.gov, any other issues that you'd like me to address on today's call? Okay. Well, I want to thank everybody for their time this morning. We will have another meeting next week. We'll go over any other issues. I, again, appreciate everybody's time. Gigi, do you have anything else you'd like me to cover today? Okay. Thanks, everybody. I hope everybody has a great day, has a nice weekend, and thank you for your time.